The 3 Ds that every patient should think about when they visit the doctor are discuss, debate, and decide. And what that means is that when you go to your doctor, decisions are being made all the time. They may or may not involve you unless you make sure that you're at the table. So every time that your doctor gives you advice, it means that they have thought about all of the options and are giving you the recommendation. What ideally should happen is that you should be involved in that conversation. And some doctors are better than others about looping patients in. And if you have a kind of doctor who is less likely to involve you in those decisions, then it's your job, it's your role to activate yourself and say, I want you to know that I'm really interested in my health care, I'm really interested in what's going on with me, I want to know as much about me as possible. So can you go over some of the options again that we have, and can we talk about these in a little more detail so we can make the decision about care that's best for me, that fits best for my lifestyle. And once your doctor knows that you're interested in that, they'll open up and sort of involve you more. But sometimes if physicians aren't aware of your preferences and how active you want to be, they'll just assume that you're not really that interested. And so, so the 3Ds, again, getting back to those, are the 3Ds what we call shared decision making, which is really a very basic and easy concept, but we think that patients should be equal partners in sharing and how decisions are made about their own health care. And so there's discuss, debate, and decide. So every time that there's a treatment recommendation or every time there's a diagnostic dilemma and how to sort of figure out what this problem is, you should discuss that with your physician. Make sure you understand all the options that are available and the pros and cons of every option. If we're talking about bypass surgery versus balloon angioplasty versus medical management, what are the pros and cons of each of these situations? And then debate to really flesh those out, So you said this is a disadvantage. How does that really relate to me? Now, do I have something that may put me more at a disadvantage if I choose this option than that one? So debate is really sort of having a robust discussion about those treatment ones. And then D is decide, that you want to come to a decision that you understand, that you know that you can do, and that you feel comfortable with, and that you and the doctor agree on is the best thing for you. And so you want to leave there feeling empowered, that you know what's going on with your body, you have a full understanding, and that you've signed off on what that plan of care is. And ultimately, if that's the case, then you're going to have better health outcomes no matter what the decision is.